Do you remember the first thing you ever tried to build?
The first thing that I ever tried to, yes, I do. My friend and I had this idea to build a beauty marketplace, basically,
Oh,
right?
wow.
Where people could like order a hairdresser or like nail things for at home. I think that was before COVID, so that was like before tech in the beauty industry was a thing.
Mm.
It just died out during COVID.
As most things did, though.
Right?
Yeah.
Yeah. Like we planned everything. Yeah, I was very excited and then we just lost momentum, I guess. Yeah.
Damn.
Yeah.
Um, why do you think it was something you wanted to do? You know, like I think it's always interesting when you ask people the first thing they tried to build, it's always like it's almost like play first. It's just
Yeah.
like I wanted to see what could happen if I tried to build or solve something. What was your motivation?
I hate going to the salon.
Oh yeah, no deep and meaningful.
Like
No, sir, listen.
and like things are so expensive now that like every
Mm,
time you move to like a new place, like your Rosebank or whatever, it's so
mm,
expensive. Like, and you have to hunt, go to CBD to find somebody who can do your hair. It's just such a journey. I
yeah.
just wanted to make my life a little bit easier. And I felt like if I feel that way, there's probably other people who feel the same.
Do you feel like you have a passion for trying to solve different problems?
Definitely. And
Hmm.
more like, I think I'm more of like a social entrepreneur. I really like to build things that I feel will make like everyday life much easier.
Mm.
Yeah.
Social in the sense that there needs to be impact in the things that you're building and purpose behind it as well.
Yeah. I
Okay.
wouldn't I wouldn't do well with building a game as an example because for me it's like, it's just for fun and whatever.
Mm.
Yeah.
Tell me about garden health.
Yeah. So 2020, wait, 2019,
Mm.
I started planning to go back to school, right? So I'm like, okay, I want to do research. It needs to be in health. And I found a supervisor. Everything was sorted out. And then just started reading a lot of papers. And I found this issue, fetal abnormalities
Mm.
around pregnant moms, right? So when they're pregnant, I think it's at around 20 weeks that, the medical professionals are able to detect whether there's an abnormality with the fetus or not, which I thought was a bit high. Like I kind of placed myself in that space. Like if I was pregnant, I think the earlier the better, especially because then you get the option to terminate if you need to and things like that.
Mm.
I was very excited about that. I sure remember the day afterwards, I got into the office and I was just telling everybody about it. But there isn't actually great data for you to do like all these machine learning AI stuff on because I don't know if you've ever seen like the scans that pregnant moms get. They're like black and white and things like
Mm.
that. So to try and do any sort of like machine learning or computer vision on that is not great. Like you're not going to get good results.
Yeah.
So that's what my supervisor told me. But then I was like, you know what? Actually, one of my friends, we used to work together at that point, who is actually the one of the co-founders of Guardian Health. He found a hackathon, which was the IT Web hackathon,
Mm.
and he's like, "Yeah, let's go, let's get some cash." This was like our second year working, so we kind of like really broke at that point. So it was 10,000, and we were so excited. Like, okay, we get 10,000, 5,000, 5,000, great, right? And yeah, like he's like, yeah, let's go do it. That was the first hackathon that we did, and when we were talking about the topics that we should do, I then pitched the research. Then we found like a random data set online, those public data sets, which was going to kind of help us to prove what we're actually trying to do. And we actually won that hackathon, which was also like the beginning of our journey because we then met some people at that point pre-COVID. There was some research being done at Bara actually around pregnancy complications and just, I don't know, like solutions around pregnancy basically. And one of the people who was there was from an innovation department within the government sector, whatever. I don't know. I don't remember the name. But basically, he's like, hey, you know what? We're doing this thing. This is a great idea. It really aligns with the problems that we know exist. So I guess he kind of pushed us a little bit in that sense that it was like, at that point, I wasn't going to do it as my research anymore because of the data issue. But then being able to engage with people at the hackathons and building upon like whatever feedback that was coming back was like, okay. But it took us a while. I think we did not immediately go, okay, we're doing this. We're actually starting a startup. Initially, it really was about the money. I'm not even going to lie. We won our cash and we made sure we went out there and we were balling.
And I think, and it's okay, right? I think like it's interesting that, so there's two parts to this that I really want to talk about is how important is that, that education, that passion that you clearly have for education and using education and resources that are very education based to enable you to understand problems before you try and build those solutions.
Look, if I didn't have the degree that I have, I definitely would never have started this, for one, right? This was literally at the back of my studies, in like the perfect sense. And I think a lot of the problems for me personally, I think a lot of the solutions that I've come up with, I definitely have to do with my education. So if the question is education important? Go to school, guys.
And then there's the other part, right? Which is like, you guys are freshly out of school.
Yeah.
And you find this hackathon.
Yeah.
How important are, those environments for builders when you have the passion, you've now validated that there is a problem with the sort of data that you have.
Yeah.
But now you want to be able to build it out and have tested in a certain environment. And I think hackathons can be very safe environments for testing and learning different ways.
Yeah.
How influential was that for your journey?
I can't even begin to explain this to you. I think the one thing that I've learned, right, in my journey as an entrepreneur was the importance of knowing the right people, as an example. And I think if this idea had started at home and we had just started building it without going to these events, I think we wouldn't have known the right people that were able to actually accelerate this for us. Just knowing the right people who engage with you. There are actually two parts to the hackathons, right? So we won a lot of hackathons as a start. During COVID, we were just doing hackathons. Initially, it was about the money, but even at that, we still met quite a lot of people who became mentors to us, who gave the right advice to us. Even when we launched officially, we could actually call people that we wouldn't have known at that point had we not gone to those. But I think another really important aspect for me was the financial component of it. Because once we decided that we wanted to actually be a startup, you need money to run a business, right? It's a tech business. You need to pay for cloud services. You need to pay for licenses, you name it. Even buying laptops, right? Like buying the stuff that you need. And the hackathon money really enabled us in that sense, or even some of the programs that we would join and be a part of. When you win that 100,000 Rand, that is money that you can then use to run the business as you go. There's also obviously the part where we were bootstrapping it because we are both working, which means we also have to pay some of the bills with our salaries. But I definitely think that from a networking and like finance perspective, hackathons are beautiful, but also because you actually get feedback for free. Especially when you join hackathons that are specific to your theme. So for instance, you can join a hackathon that focuses specifically, let's say, on health, right? You know for a fact that there's going to be stakeholders in health at that hackathon because that's the theme of that, as an example. You're going to meet, the Minister of Health, as an example. You're going to meet health professionals. You're going to meet people who are interested in that space. They're going to want to be interested in the idea. They're going to give relevant feedback. Because I think one of the things that I always say was, when we started building this, we built it based on research. And that is so far away from reality because some of the research that you find online may not even be South Africa specific, right? Could be like global research, just what are the challenges in healthcare. But once you start talking to the doctors and you say, okay, cool, this is what we have, this is what we've built, then they come back and they're like, amazing, the idea is great, but we can't use this within our space, within the South African context. But when you go to hackathons, now you're getting all this feedback for free. So besides hackathons, I just think going to events and speaking to your users, right now I do it randomly. I just, hey, doctor, whoever, can we please jump on a call whenever you have a few minutes and just tell somebody about your idea. And there's so much valuable information that you get, even without you selling the idea to them. Just, this is what we're trying to do. Do you think this is something you would use or not? Going to pregnant moms. Hey, I know you're pregnant. What are some of the challenges that you faced within your pregnancy? Just talking to users. So I think for me, that has been the value of hackathons. So yeah, I think hackathons are the way to go. Events in general, tech events where you get to exhibit your ideas, where you get to talk about your ideas, definitely do it.
Yeah.
Yeah.
So, initially you find this research and you go into these hackathons to test these things out. What did you guys initially try and build? And then through that feedback,
Yeah.
what did you end up actually trying to build?
Yeah, that's a beautiful question because
Because
we
there's
are
a world
so right.
between those two things, right? Like there's the initial assumption that you have, I know,
Yeah. Exactly.
Steve Jobs, and then
Yeah.
oh no,
The idea is completely different to what it was when it started. Still the same sector, still the same target market. So when we first started, we had a data set, and the data set, there's this machine called a cardiography machine, cardiography machine. I struggle with the word. But basically what it does is that it gives, it actually, I don't know if we have this machine in South Africa because the data set itself wasn't actually a South African data set. But basically what it does is that it's a machine that's used on pregnant moms, and it's able to detect certain things. The stats that you get from the machine can help you to detect certain things. So when we first started, we built some machine learning algorithms. We literally had a notebook, and it had like some machine learning algorithms where we were like, oh, what's the probability that a mom with these vitals actually is carrying a baby who may have some health issues, right? So we had something like that. And that was actually the start of it. But then I think when we started now, when we were like, we want to now shift to building something, we had to go, this is a great idea. I think it's something that is very useful, but is the nation ready for it, right? Because also, one, it's a very sensitive space. You can't just have something that's not going to be correct, right? Because this is you telling people that you may be carrying a baby who has issues.
Yeah.
It's you can't just say that, right?
Yeah.
But also at the same time, it was like, it's as much as we understand that it's useful, we really need to have good data. We need to have a lot of surety in the solution that at the very least, maybe 98% of the times, it's actually giving us accurate information. So there was a lot of sensitivity to that. Then I think because this was during COVID, we were like, okay, cool. You know what? We want to be able to have a leg into the space. So we then built just a normal telehealth platform, but specifically still saying that it's for moms, and what it does.
Can you just explain what telehealth is?
Yeah, so telehealth is basically being able to give access to digital healthcare. So being able to access health professionals digitally, having virtual consultations. So we have a platform that has virtual consultations. It's got digital notes on the platform. You can get your prescription from the platform. I think we were like, now we need to define our journey, because there's a lot of virtual platforms that actually started during COVID. So now it was like this really saturated space. And what we then decided to do at that point was, because we still really want to make sure that we make a difference as it pertains to moms and issues that they face during pregnancy, we decided now that we actually wanted our platform to be a remote monitoring platform. And this is kind of where we are, and we're like trying to, crack into the space. So a lot of moms, I think one of the things that Dr. Silepe likes to say, Dr. Silepe is our medical consultant. He's our medical professional at Guardian Health. And what he likes to say is that a doctor gets to see the patient once, for the 20, 30 minutes, right? But then there's a lot more that happens when the mom is at home, right?
Yeah.
That's where the blood pressure goes high. That's where the issues start, right? And what we want to do is we want to be able to bridge that gap, so that as the mom is at home, they're monitoring their vitals from home. And if something goes wrong, they get to know immediately that something is wrong. Because due to other issues like being far away from healthcare, being having to go to work, people tend to delay health concerns quite a bit.
Yeah.
So with this, we basically are integrating devices into the platform, and moms can get devices that are relevant for them based on their health profile, and then they can monitor vitals from home. And, we remind them to do that every day. And then if something is going wrong, you get to be able to, we get to also remind you to see your doctor. Even if it's virtually, your doctor will see your stats. And if they think that there's a concern here, then they can tell you to go in. So that's where we are at this point in time.
Yeah.
Yeah.
We now, you speak about pre-COVID, and I think entrepreneurs have a very visceral idea of what that means, right?
Yeah.
Post-COVID has become a very data, AI, very heavy on, being able to access a lot of information very quickly and use data in very meaningful ways. How important is, that aspect of what you guys are doing, and being able to make this data not just available, but actually actionable, and being able to prevent anything, difficult or bad happening before it happens, or at least being able to make sure someone gets help, much sooner.
Yeah. I studied part of my honors. I did big data analytics. So I definitely understand the value of like using data to make decisions in general. But I think one of the beautiful things is we actually are collecting all of this data, right? Which is owned by the patient, and they get to decide who they share that data with. But I think there's just so much power in being able to look at a patient's data as a timeline, right? It's like, so you last went to your doctor last month, 4 weeks ago, and this is what's been happening every single day for your health. It's just going to give a more complete view of the patient's health, right? I think one of the things that was quite fascinating for me as well was apparently health professionals can even decide if a dosage of the medication is to be adjusted, right? Based on how you've been reacting, right? Maybe you've been okay. Maybe you're just nervous when you go to the doctor. So you don't
So
like
that just affects things a little bit as well.
But this gives like a more complete view of how you are, right? Which means that now people are like, oh, this is how you've actually been doing. You've been great at home, right? But we don't know what happened in this 30 minutes that you were here. Maybe something happened today and things like that. So I think it's so powerful. But I also really like the fact that the moms actually own their data, because it means that, so actually when we were still experimenting with the idea of like remote monitoring, I had a skin issue and I struggled so much, right? I went to so many health professionals and they were struggling to like figure out what it was. So it just kept getting worse. And I started to basically collect information and compiling my own health record.
Oh, wow.
And so I was taking pictures and I was recording what medication I'm taking and how it made me feel when it got worse. And the moment that I got referred to a specialist and I got there and I said, this is my health record. And they immediately, well, they thought I was weird, but they immediately, they immediately managed to diagnose me. And I've been great ever since, right? So for me, that was even before we really started to go, complete remote monitoring, because I just like to test out some of these ideas. But I think it was such an important thing that actually, like, I feel like as a patient, you also have a role to play when it comes to your health, right? But I think it's so difficult sometimes to remember the medications that you're taking. How did it make you feel? At what point did things go wrong, or where you started feeling like maybe this is not really working for me? But I just feel like if you can give that to a health professional, then it's now a more collaborative thing. And I think it would really go a long way in terms of like you getting diagnosed, you getting the necessary help that you need. Yeah.
Yeah. You're building in a very sensitive and complex space. Healthcare is known to be very regulatory, and for good reasons. These are people's lives that you are, building solutions for.
Yeah.
What are the challenges in navigating building anything in this kind of space?
It's a very sensitive space, especially when it comes to, I would say, diagnosis. I think when you look at the more telehealth part, that's less risky, right? Because really all you're doing is you're consulting with the health professional, But when it comes to something where you say something is going wrong, that's very sensitive because you could make people panic if your prediction is not correct. But also, actually a very interesting thing, I was moderating a panel discussion last year. And it was actually talking about ethics in AI, right? And it was a room full of medical doctors and things like that. And I think one of the issues that I had never actually thought of as someone who's developing solutions in the space was a point that was brought up is that we build, as tech people, we build solutions for health people. And then we want them to take these solutions and use them. And yet they are in this space where they get sued a lot. They the patient is going to blame the doctor if a tool that they adopted doesn't work properly. So they get to actually carry 100% of the risk, all right? Which is why they were saying that's why people would say, oh, doctors are so backwards, they don't want to adopt new technologies. but it's also about, okay, but what's the risk? Are we actually carrying the risk? Because I can build something and sell it to you in a beautiful way, you take it, and then you carry 100% of the risk, because if something goes wrong with the technology, they're the ones that are actually getting sued. So it just, I don't know what the solution is to that, to be quite honest, but I also just think that it's a very unregulated space. You know, we can just build something and already publish it tomorrow, right? There isn't really a board that governs the solutions that are put out there into the public. And yet it is a very sensitive thing, because I think health can, I mean, imagine if now we build something that says you likely have cancer, like you are going, it's going to disrupt your life, right? Completely. So I don't know what the solution is, but at least now I have a clear idea of what the issues are when it comes to like selling these solutions, and, you know, convincing people to use AI in healthcare specifically. It's a very sensitive space. You really need to put in quite a lot of money. It's not one where you can put out a solution and say, you know what, as we experiment and collect more data, we can already have people using it. You almost want to have a very robust thing that you're like, it's safe. Like, you know, we are going to make it as simple as we can as a start. Make sure the patient understands that it's not 100% correct. Make sure that the patient knows they still need to lean on their health professional. They can't just say, okay, this is what it said, I'm perfectly fine, when maybe they're not. So it's a difficult space to create solutions for, and yet there are actually so many problems that need to be solved.
You strike me a lot more as like a very technical, you know, co-founder who's, you know, building the solution, engineering it. How do you balance that with the business growth, adoption, getting people to use the thing?
That's a very good question because that's been such a struggle. But I do think that from the time that we started, I think I've also grown a lot as a person. I think the balance itself was very difficult. Even now, I was telling you that I sometimes just reach out to people and you know, hey, can we have a chat about the solution that I have? And I couldn't do that a few years ago when we started this. I was very technical. I was very inexperienced. I was still very young, not very confident and all of that. And I used to take no's very personally. Like, I need to be down and hibernate for weeks because somebody said no. But now I think I don't really take no's personally at all. You know, in fact, sometimes if a person says no, I actually want to know why. Like, is it because you're using another software, or is it because you just don't think that this is going to make a difference to you? So I think now my mind has kind of changed to understand that the no's and the yeses, actually both of them are very valuable. In fact, you may actually get more value from a no than a yes, because with the no, you can know if you have any competitors, you know, what are people currently using, why are they hesitant to use your solution. So in terms of balance, my co-founder is very technical, a lot more technical than I am. He's like there in the dark somewhere doing his thing. So he handles a lot more of the technical stuff, leading, you know, architecture and everything and all of that. I do still code as well though, but when it comes to like the networking and forming the right relationships, selling and all of that, I do that a lot more.
You know, just talking about those relationships, how important have partnerships, but also the support in the ecosystem been to Guardian Health? But also, do you think there's a role or, you know, a lot more support that you guys could be getting?
We have received a lot of support. I don't want to make anybody feel like they haven't done enough. I think genuinely on average, because, you know, we went to these hackathons, which we would win. And a lot of times companies that host these hackathons do want to actually provide support to companies that have won their hackathon, because they want their hackathon to have impact, right? To have an impact. Like our winners actually went on and became something. I mean, we've received a lot of support from like your Gig Culture, your MTN, your Ayoba. Like so many people have really stood behind us. And I think even from an advice perspective, we have people that we can reach out to and explain what we're trying to do and like hear what their opinions are. And these are people who have a lot of experience. I just think that entrepreneurship is very tiring in general. So I think that there are times where we become a bit discouraged and maybe we're not working on it as much as we should. But I don't think it's a support thing in our case. But I think overall, though, in terms of like other entrepreneurs, I do think that those who didn't necessarily go through the same path, I think there's a lot of support that can definitely be offered, because there are certain ideas that are really difficult to get out there without like a solid company that's partnering with you or that's helping you out, which is where I think generally maybe that's also where we're still lacking, you know, like sometimes having a big brand saying, you know what, we're endorsing this idea or we're trying it out. It just adds so much more value to that.
Yeah. So, you know, you said you use no's as data to, you know, really be able to learn more about what you want to do. And I think that's just your passion for data coming out again. How do you guys deal with failure? But more than that, what do you do when you win?
Yeah. So I think now we are a lot more used to failing. We have failed a couple of times that it's like, oh, okay, cool. We need to just keep moving, learn our lessons and keep going. I think in the past, it would be a thing where we maybe even start questioning whether it's worth it. Like, is this worth it? Is what we're doing worth it? And things like that. Sometimes you do feel like, you know what, I feel like I've been putting in so much time and I just don't feel like I'm getting the results that the work that I'm putting in actually deserves. But now, honestly speaking, I was actually figuring it out the other time. I was like, I really take no's in a beautiful way now, and actually in every aspect of my life. And I think it's actually, I can give credit to the whole entrepreneurship thing. Like, I just think in general, like no's really don't faze me at all. Like for me, it's like, okay, redirection. We need to figure out how to do it so that we can get the yes and all of that stuff. So yeah, like for me, the wins, spoil yourself, you know, take 500 Rand and go have a nice meal. We don't take the whole thing anymore.
What is the future of Guardian Health?
We really want to make sure that we can bridge the gap between appointments and moms being at home, you know, just making sure that they know that they actually own their healthcare, you know, they are collaborating with their health professionals, they're able to get more proactive healthcare, you know, access to health, being able to find specialists on the platform, you know, when something goes wrong. You know, with the health record that we have, combined with the vitals, combined with your previous prescriptions and all of that, I think that can really help to maybe make moms get more proactive care, but also for the moms to be aware that they also need to watch out for their health. Being able to go, oh, you know, when I eat this way, I've noticed that my vitals behave in this way. So basically, we want to build a community of women that are more aware of their health and what habits actually contribute positively to their health and what contributes negatively to that, you know? Because honestly, I think for me, I mean, I'm a person who's really getting to a point where I think that a lot of the health, I just feel like nutrition, how you take care of yourself at home plays such a role, right? But I think when you are seeing how, okay, I've been eating a salad every single day and actually, you know what, this vital has been controlled. It's been great. Or I've been going for a run or for a walk every day and this is how my health has been reacting. I think that really makes a difference. But also just create a community, because we don't just want to have health professionals like doctors only. We want to have your physios. We want to have nutrition experts. We want to have therapists. We already have therapists, but basically just holistically, you know, how do we make sure that moms are able to have healthier pregnancies? That's just the passion, because the mortality rates, the pregnancy mortality rates are really shocking all over the world. And this is not even like a South African issue or an African issue. All over the world, pregnancy is such a risky thing because there are so many things that go wrong just because you're pregnant, right? So when you look at the amount of complications that are actually preventable as well, right? Because there's quite a large percentage of issues that actually happen during pregnancy that end up causing things like the baby not making it and things like that. And these are preventable things that if they're caught earlier on, we can actually make sure that a mom has a successful pregnancy. So that's the passion. We're just passionate about pregnancy.
Yeah.
Yeah.
You're doing such really important work. And I think the impact that you're going to make in the future is going to be incredible.
Thank you.
What is one piece of advice that you would have for, another South African person who's watching this and they have a passion, maybe not for pregnancy, but for solving problems, but using technology to do it, which is what you've done.
Yeah.
What's one piece of advice that you would give to them?
I would say start now. I think we often wait for the perfect moment to start an idea, let me get this out of the way. But ideas actually have an expiration date, actually, because if you have an idea, somebody else out there has the very same idea because you've noticed a problem that other people probably notice as well. So from a competition aspect, you want to start at that point in time, but also sometimes starting means you can literally start talking to people. Sometimes it's not even like start coding, right? Because you still need to do research. You still need to figure out if the idea even makes sense, But start doing something, like talk to somebody, read a paper, but mostly speak to people. Like I feel like for us, I think that's been the biggest lesson of all, because I think the direction that we are now is completely different from when we started, because I think we started talking to people a bit late, right? So we built things based on what we were reading. But once we started to speak to people, we realized as great an idea as it just was a level too high based on where the healthcare system actually is. People are not going to trust that solution at that point. So I think just research, start talking to your users, start doing your research. Honestly, you have nothing to lose. Like if you build something and it doesn't work, you're a better programmer anyways, So
Win-win.
Win-win.
Just take the win. Thank you so much.
Yeah. Thank you.
Thank you for watching the Mashstartup podcast. If you enjoyed this podcast, please share it with a builder that needs to start or keep growing. We're building a community for opportunity creators, solution builders, and entrepreneurs. Go to www.mashstartup.co.za to learn more. Thank you for listening.